Today on eNCA, we have been focusing on the state of hospitals across the country. In many ways, the COVID pandemic has highlighted the challenges in public health: staff shortages, equipment shortages, workplace fatigue, mismanagement and corruption. Now, the Western Cape was the first province to deal with rising COVID-19 numbers, and now it's on alert as infections rise again, particularly along the Garden Route. I'm joined now by the head of health in that province, Dr. Keith Klutter. Good evening, Doctor. Thank you very much for your time. That report by Monique is really distressing, and she talks about the moratorium on medical posts and that this is something that comes from National Treasury. Does that mean there is nothing you can do about it in the province?
Good evening, Sally, and good evening to the viewers. Just to clarify, within the Western Cape, we have a challenge in terms of the budget available for filling of posts, but there is not an absolute moratorium on posts in the Western Cape. We work within our budget constraints and we prioritize the posts that we can fill. What we have in the prospect of happening over the coming year is that there is significant pressures on the budget that we will be facing next year, as announced by the National Minister of Finances in his budget speech. As we speak at this point in time, we are prioritizing where to deploy our resources and how to prioritize which posts to fill. But just to stress, there's not an absolute moratorium of posts. We can fill, but within the constraints that we have.
I see. So money is always the problem. How many unfilled posts do you have?
Well, because of that, we have a filled rate of more than 94% of our posts are filled. So it's less than 5% of posts that's not filled. And what we do, it varies from facility to facility. So that is the broad range within which we operate.
All right, because the report from Monique Mortlock, there are people, first of all, who are too afraid to speak out about just how bad it is because they're afraid they're going to get victimized. But secondly, they're saying they're doing, I must do 2 or 3 people's jobs because we are so few. That doesn't sound like 94% of the posts are filled at all.
Well, that is the parameters within which each health facility is staffed because of the resources. You see, you have to understand that it's been a chronic difficulty that in terms of the staffing that's available. And what you face in this situation is we have increased patients and increased patient numbers coming to the health facilities. So people have been working with the limited staff that they've had. And obviously increased patient load then puts additional pressure on the people finding themselves in the health facilities.
And you talk about budget constraints. Surely there shouldn't be any talk of a budget constraint in the middle of a pandemic. Does that suggest that things are just going to get worse in the coming year?
It is likely to get worse because what we've had during this financial year, we've had some additional resources to assist us with the COVID peak across the country, I guess. And in the Western Cape, we've also got additional resources. But the budget allocation for next year and the preliminary allocation we're working on is a shortfall of budget. And that is a National Treasury reality that each of the provinces are facing. So we are doing our planning in accordance with constraints. The issue is that we have a second wave of COVID being a very stark reality in the country, as you've witnessed in the Eastern Cape. We are starting to see the early signs of rising cases in Garden Route, definitely with really escalating cases, and in the Cape Metro as well. So a second wave of COVID is a reality, and we're facing that on top of the fact that we have resource constraints going into the new financial year.
Could you update us on hospital capacity? I know it's a concern in the Western Cape parts of the Garden Route. Which hospitals are you most concerned about this evening?
Yeah, at this point in time, there's pressure on all the public sector and private sector hospitals in the Garden Route. We are extremely concerned about Knysna. Knysna Public Sector Hospital has had the biggest constraints, but also the George Hospital, which is the regional hospital in George, obviously. And then there's been pressure in the private hospitals in Mossel Bay and in Oudtshoorn, in Mossel Bay specifically. But that is the constraints, and there's increasing caseload across the hospitals in the Garden Route.
What's the plan for the festive season? We see floods of people from the inner regions moving down to the coast for the holidays. feasibly, you could end up with those hospitals under even more stress. Never mind that it's also festive season, there's more drinking, there'll be more accidents and there'll be more fights. Have you got a plan in place to perhaps get staff from other regions? What's the plan?
What we're doing at the moment is we're maximizing staff, obviously, and wherever we can utilize staff, we try to deploy additional staff. The concern is the coming festive season, and it's not only in the Garden Route, it is across the whole of the Western Cape. And we're obviously very concerned about behaviors, people gathering, being in closed places, and not observing the social distancing and mask wearing as they should. So our plan is really to mobilize as much as possible to population and the community behavior to maintain the spread of COVID. We're also on high surveillance, so we can track and we can find every single case and new cases. We track it in the geographic areas, and then we're monitoring the hospitalization, and we have escalation plans to increase capacity as required for COVID during the upcoming weeks.
Well, thank you very much for that update. That was Dr. Keith Klitty, Head of Health in the Western Cape.